Sounds good.
So thank you so much for being here today. Could you first please state your name and career?
Sure. My name is Elise Fields. I am a clinical pharmacist, and I presently work as a medical science liaison.
And so, since you have a PharmD doctorate, I was interested in learning more about what a PharmD program looks like, the steps, the years, and more about the what kind of coursework you get and the course load.
Very good questions. So for the US pharmacist programs, they can be either 3 years or 4 years. And depending also on the school, you might go in straight from undergraduate and complete in 6 years, or a lot of people go back after obtaining a bachelor's degree and then go to pharmacy school as a graduate program. I personally went to the University of Washington, which is a 4-year graduate program, although there were a couple of students in the class who had gone in straight from undergraduate. You wanted me to speak to some of the classes. The classes, depending on your school, may prioritize chemistry. They might prioritize therapeutics, which is looking into disease states and how you would treat them. Some schools have anatomy and physiology, like mine did, where we were dissecting and reviewing the human body. Other schools do not. Some schools might emphasize speech. Other schools might have a higher emphasis on going out in the field and working with pharmacists. It really does depend on the program. And my advice would be to look into the differences in programs as you're applying, because even if a school might be more convenient for you geographically, might not serve your intentions for what you'd like to get from a program.
Mm-hmm. You don't have to say which program you went to, but could you explain why you chose the program type that you did and how it set you up later for the career path you wanted to go into?
Yes, I went to the University of Washington. They're based in Seattle. I did mention that. And what drew me to Seattle, I wasn't originally from Seattle, but I had seen that they had a strong program that was highly ranked in the pharmacy school top programs. And I also appreciated how many certificate programs they offered, that I pursued one in global health. I was the first pharmacy student to be able to manage my pharmacy school classes as well as my global health classes. And through that certificate program, I was able to travel to Africa a few different times. And I also was able to interact with students in the other healthcare programs. So I really appreciated that. And I think it also set me up, having done that certificate program, because it set me apart from the other pharmacy residency applicants. I had done something different that a lot of other people hadn't been able to do. I had set up this program for me to work with the certificate and then to go to Africa. So I was able to speak to that when I was applying to residencies, which is a very competitive process.
Mm-hmm. So, what did an average day look like for you in PharmD, in a PharmD program? What did the course load feel like, the rigor, and what kinds of activities did you do beyond school?
Good questions. Now, I want to note, I went to pharmacy school and graduated in 2012. I believe the University of Washington has restructured their program since I went to school. And again, I would encourage you, if you're applying to pharmacy schools, to understand each year what they're planning to do. When I went to pharmacy school, the coursework was the emphasis for the first 3 years. And then for my 4th year, we went on rotations and we were exposed to different roles that pharmacists took out in the world, in hospital, in the community, in industry, working with pharmacogenetics. There were many different opportunities, and that was your chance to see how other pharmacists practice, so you could understand A, the bread and butter of what you would need to do if you went out, and B, what you might like to do when you graduated. And I think you also asked me, what did I do for extracurricular activities during pharmacy school? I was on the pharmacy school board. I also interned as a pharmacist in a hospital. I also interned in a community. I also interned with a managed care organization. So I had exposure during my internships to different pharmacy roles as well before that 4th year of pharmacy school. I also played ultimate frisbee on the side for fun.
Yeah, sounds great. So I wanted to talk, probably should have asked this before, but I did want to talk about why you chose to be a pharmacist. So previously you mentioned that you decided to become a pharmacist because of your work as a medical science liaison. I can't pronounce that. Could you explain what kind of work you conducted in this career and how this work inspired you to become a pharmacist?
Sounds good. And just to clarify, the medical science liaison, I had been working as a recruiter for medical science liaisons before pharmacy school. When I graduated from the University of Michigan, I had done biology and psychology degrees. I'd been pre-health, so I had a lot of exposure, and I'd been interested in pharmacy school from a class I took called neuropsychopharmacology. And after I graduated from Michigan, I moved out to Portland, Oregon, and I took a position recruiting medical science liaisons. And I had learned that those were mostly people with PharmD backgrounds, like the doctor of pharmacy I have now. And I thought that would be a great opportunity for me to learn from these people when they were actually trying to get a job, so I could see that what they liked, what they didn't like about a role. I was hearing from them truthfully when they were not surrounded by work and trying to be professional and having to teach somebody. It was actually a more honest conversation. And from those conversations with these medical science liaisons, I learned that I definitely wanted to pursue a career as a medical science liaison. And from those conversations, I also learned the steps I needed to take. So I did need to go to pharmacy school if I ever wanted to be a medical science liaison. I likely needed to do a residency, so I had a stronger clinical knowledge. And then I also probably needed to get some additional experience after pharmacy school so I could speak to that when I applied to jobs.
Mm-hmm. So when you were applying to like PharmD programs, what did the process look like? And were there like activities or extracurriculars besides your career recruiting medical science liaisons that you did prior to pharmacy school?
Yes, besides working as a medical science liaison recruiter, which did give me inside knowledge, I had also worked in undergraduate as a sitter for patients at the University of Michigan's big hospital. So I had been bedside with these patients who were disoriented and just trying to make sure they didn't get out of bed. But I had a lot of exposure to physicians and nurses, so I understood how the hospital system worked. So that had helped me too. I also studied for the pharmacy, the PCAT. It's a prerequisite that not all schools are requiring anymore. And that's another thing I had done, is I'd scored very highly on that. And I had high academic scores for my undergrad as well. So I think all of that made me have a very competitive package when I was applying to pharmacy schools.
Mm-hmm. Yeah, so just after PharmD school, I see you have to do residencies. And so what field did you decide to do your residency in and why?
Good question. So I did my pharmacy residency with an ASHP, which is the American Society of Health System Pharmacists. That was an accredited residency through ASHP. And I did a hospital residency with an ambulatory care component. And the ambulatory care component had me working in a clinic for half a day a week. And that enabled me to get to know the diabetes patients very well. And I'm guessing you'll ask me about that, but I've done a lot of work in diabetes as well. And that was my first exposure through that residency. And I had sought out that residency because, well, one, I wanted to live in Portland. Two, I had met the people in the program and I really liked them. And three, I liked the program itself, the combination of hospital and then ambulatory care.
Mm-hmm. So what did an average day in your residency program kind of look like, and what I obviously it was more like hands-on, but like how much studying did you still have to do while you were in a residency program?
Very good questions. So the residency took about 60 to 70 hours every week for me for that full year. And it was a combination of rounding with the physician residents in the morning in the hospital, and in the afternoon making patient interventions on medications, and also in the afternoon working on projects. As a resident, you're involved with multiple projects. I had a year-long project on improving how the hospital pharmacist reviewed anaphylaxis reactions that were recorded in the electronic medical record, and that took up a great deal of my time. I also had other projects where I would review new medications, and I would put that in front of the hospital committee that is called the Pharmacy and Therapeutics Committee, to have them take a look at it and see, should we add this drug to be included for our patients at this hospital? So that was another thing I was doing. As I mentioned, I also worked a half day a week at the clinic, working with patients with diabetes, hypertension, high cholesterol, and the rotations would change every month. So some months I would be working general medicine, some months I would be working the trauma, other months I'd be in critical care. So every month you were having new projects. And I also even was able to obtain a teaching certificate where I was going to a pharmacy school nearby in Portland and teaching the students at that pharmacy school.
So I saw that you have a board certification in pharmacotherapy and a certification as a diabetes care and education specialist. And so what did the programs to gain these licenses look like? Was it already ingrained into the curriculum in your residency program, or did you have to take more classes to get these certifications and licenses?
First, I'll answer the one about the board certification. That board certification is for short called the BCPS. And if you complete a residency accredited by the ASHP, which I mentioned to you before, the American Society of Health System Pharmacists, then you're qualified to sit to take the exam. And the exam takes a lot of time and effort to study for because it's pretty difficult. Not everybody passes on their first try. So after I completed my residency, I was encouraged to take it. And so I studied for it. You do not get guaranteed to pass it, and you also have to pay for it. It's not included with the residency.
Mm-hmm.
The second thing I did was the certification for diabetes education. It's now called the CDCES. So you could see that after my name as well. And that required me working, I think, 1,000 hours directly with patients in diabetes. I also had the qualification of being a pharmacist, which is one of the eligible professions. Nurses can take that, dietitians, physicians. You have to be in a certain pathway, and you have to work directly with patients to improve their diabetes care. So at that point, after working in the clinic at my residency with the diabetes patients, I'd also worked with patients when I was living in the East Bay of California with patients at a diabetes clinic. When I worked at a hospital, I spent a month there. And I was able to sit for this exam once I had worked as I ran a diabetes department at the Native American Center in downtown Seattle. So I had many, many hours under my belt of working with diabetes patients. And once I had those many hours, I sat and took that exam.
Mm-hmm. Lots of hours and training.
Many hours of studying. So if you like reading and you like learning, these are good pathways to follow.
Mm-hmm. And so when you mentioned like how you work directly with diabetes patients. So I just wanted to like go a little more in depth about that. So with like physicians, they mainly diagnose like patients and prescribe medications. How does your work like differentiate from like physicians? Like as a pharmacist, how does your work with diabetes patients differentiate with the work that physicians do?
That's a good question, and it will probably differ by practice site. I had collaborative drug therapy agreements which are called CDTAs for short, with physicians. So under their name, I could prescribe medications for the patients. They had, yes, received a diagnosis previously from a physician or maybe a nurse practitioner or a physician's assistant. And then I would work with the patients who were having the most trouble controlling their diabetes. And so luckily, because I was at this clinic that was pretty small, I was able to get to know the physicians and get to know my patients really well. And it was a very good community to support each other and help our patients to improve their diabetes together.
That sounds great.
Yeah.
And so now more about the work that you do after graduation. So right now, what does an average day look like for you?
Okay. I first just want to clarify that the positions I was just talking about, the residency was after graduation, and working with diabetes patients, that was all after graduation as well.
Yeah, I know. I meant after
Okay.
residency, now after, after
Okay.
residency.
Right now, I work as a medical science liaison, which I had alluded to before, how that was something that had inspired me to go to pharmacy school. So I have been working for a year and a half, 2 years almost, as a medical science liaison. And I can't speak too much about that just for confidentiality purposes, but to speak at a very generic level on this, what I do is I share unbiased information about the company's products with physicians and other clinicians so that they get to understand the products better. My job is also to help with supporting research programs that the company is doing with these clinicians out in the field to make sure they understand the drug, to make sure that they're having an okay time recruiting. So I get to do a lot of different activities as a medical science liaison. I attend a lot of conferences, I read a lot of papers, and most of all, I work on maintaining relationships with these clinicians as well. That's a big part of my role. So instead of working with patients anymore, I now work more with the physicians and nurse practitioners, physicians assistants, the people who would be prescribing this drug.
Mm-hmm. So what do you love most about your job?
What I love most about my job is the variety. I think I also like the flexibility as well. So to speak to that, as I mentioned, I get to talk to a lot of different, really intelligent people, and I get to talk to them with very interesting activities. I care about the drug I work with, and they want to answer questions about it, research related questions. I want to know those answers too. So we have things in common that we want to talk about. I also like the travel component, and that's part of the variety. I get to go to a lot of different places that I wouldn't get to go otherwise. And now that we're opening back up after COVID, it's nice to no longer be locked down and getting the opportunity to go travel and meet people where they work and get to see different parts of the country. And I like the flexibility, as I mentioned too, because no day is quite the same for me. And that's very nice because as somebody who's intellectually curious, and I can see myself having a long career here, it's important to be able to have that bandwidth to learn and feel like I have the space to do so.
Mm-hmm. So for anyone like aspiring to go into like a career path like this, do you have any piece of advice?
Yes, I have many pieces of advice. First, if you're interested in going to pharmacy school, I would advise, and this is something I didn't mention, I'd actually shadowed some pharmacists before going to pharmacy school. So I had seen what different roles might look like and knew that, yes, pursuing a clinical path versus a path that might work at a community pharmacy, that was the path I'd want to be on. So that helped me decide what kind of pharmacy school to target and what kind of courses and internships to pursue. So I would encourage anybody interested in going to pharmacy school to get as much exposure as early as possible. Don't be afraid to reach out to a friend's mom or a cousin who works as a pharmacist or somebody you know who's a pharmacist. They could hopefully make something happen so you can learn more about the role. And then as for residency, I strongly encourage anyone who's in pharmacy school to get a residency if they don't believe they're going to go into community, because having the residency gave me more exposure to different roles within pharmacy that I'd had more than I'd had at pharmacy school. I learned a lot that I have been able to take with me. It taught me how to work hard. It taught me how to think critically beyond what I'd learned in pharmacy school. And I think it helped me get set up for the future positions I wanted. And it's a very competitive field. So it's nice to have that leg up with that knowledge from residency. Lastly, I think going into any role after you graduate from pharmacy or residency, it's important to keep networking. It's important to stay in touch with your pharmacy classmates, your professors, the people you met along the way while you were shadowing or working as an intern, because they can help you once they've learned you, and they will help look out for you when you're looking for more roles.
That sounds like really good advice. Thank you.
You're welcome.
So I think those are all my questions for today. So thank you for letting me interview you and teaching me more about this career path. I know I learned a lot today. I didn't really know much about this career path before today, and I was very interested in learning more.
And if you have more questions, please reach out to me. I'm happy to help you or any other women who are interested in learning about this field.
That sounds good. Thank you.
You're welcome.
So I hope you have a great day, and I will send you the recording.
Okay, thank you. And I'm happy to, if you're done recording at this point,